Yat shikedo shidene. Shas twisani elken doj eken. Kodo ya aj na or kit shikedo shidene na kitamo june. Kodo hana igi ni ishjan endel do be anil to the zen. Oko to the zen she ya kodo be adil Koden hojon dole shamana hastan yadelhil. Zillistan twistan chalhiel kayol kal no de tsui. Khadedin nilt ani sa anna rebik a hojon. Kododi bini bi intona dilzen hodi in the nedanolini. Sa anna rebik a hojon ni glon anandi nekon. Todezen lini hon ben na ini kan. Adon hidden nekon. Da ist do chanada as gezikon. Na habel wan lorole alla anazino. Alla anaz danago ado bagan na has ango. Bekonta del klido bekwanesh gishnas trango. Betronas kango betesk ehnaz lago. Benal tloshi nda kego hon ya at hon. Nada hast ado le. Ado kon etalate na anin lini. Ni je besh bahasa anadan linin hitratnas nile. Ado tnesh jibe dabat ochihi kon. Ya at hon. Nsaha kes lini iti na de yi nildo. Ben nachet nat bahojonin kon. Nachan nata ha ado le. Als hon de nebel gehotse bakao. Doben nago hashine la. Ni hidden en lini kon dat ntsade kon. Benan nischen delt I. Dobe otraten delt I. Ni hitch an da ba. Ado kon hit a latso dan lini kon. Na habik etjet lido le. Ado altron. Ni hi massanin hitchen hi nalle dan lini kon. Betrata holtzelo. Da bi nego hon na den glado le. Ha ishin ben se kesto bet il anin kon. Ja at endas lido le. Ni hi man hi je. Adon becheje dan lini altron. Adon hi massanin hitche dan lini. Altron ninche ha olnon ha insen dole. Ado kon hi de nebel ha hotzabaka akon da inishi. Ni hi de ne en lini kompetis kliji dan lini altron. Ja at hon benanishin lini de yo dole. De descendole benat an lini de descendole. Adon hit of cage cane he yajin he away dan lini. Hon da ultra ja at hon ultra lini. Itti de yi nildole. Nas go net nij yen dat ntindole. Do ye etat edole. Man nishbi yisi belek etahin la dole. Ado kon nacha atat ini don ni hit a lan lini nacha atahalyadole. It's isni jahitan lini altro. Ja at hon da kredo. Altro ne benanish. Ye chata ilni go nacha insendole. Ado consolato da dan lentish not ja at hon hich anta holodole. Ni hi yajin hi ewe ni ebike. Ni hi ni itas ande ja at hon da kredole. Dit so dezen de dis nache betrahia hot dole. Hala di nal doi hon. Ben nache etahuil za dol hitahuil za. Naspo net nje hiena da il titole. Yo on net hizan lini belche yana del titole. Wat so dezen lini ahun shehen de kodo. Behanana sit dole. Do din hitinesa beche il ini. Ya at sho yetani zit dole. Na ntin inanat dole. Wat don iya kodo ni hit itonade sindole ni ket adon len hitit aje. Ben ha nahol yadole kon he eze il enakon altronien hit ishtan iyosen. Biket I trado biket I tindo bik echonil idole kon. Konzero etonade sindole adine ben hit wajonasli wajonasli. Na yeah, she edo shit ne. Kodoshe khane linin hich na nail ne dole. Big edit o tinto nasgo ben not kindole. Kodoshe kon hina tanin lini tilin liniot bich na nail ne dole. At this time, thank you for tuning in. It is Tuesday morning. Again, February 1st, thank you for tuning in. And at this time, we'd like to hand it off to our president of the Navajo Nation, Mr. Jonathan Nez. Thank you. You're on mute.
So yeah, Dr. Fowler, and thank you for the prayer, Dr. Fowler. Raphaelia Fowler for always being there to help and to help translate as well to our Navajo people. Yes, it's another update from the Navajo Nation regarding COVID-19 and what's transpiring here lately. We have seen a big surge on the Navajo Nation, but I know that we're many of us are so focused on the Navajo Nation that we don't see that this is happening all across the country, and it's even worse off the Navajo Nation. Our thoughts and prayers go out to the people that are being hospitalized. Most of those folks that are being hospitalized are unvaccinated people. And we see jump, and you'll see that shortly. Eli, if you could go to the first slide. Today, nasnigi, hikeni hidnap that does nagia. The kosinskagi nas aids at the la. The nebiki up ka okon the toda studying how it's zogo. Ya bala la ya blush lai. But that does not. Sa zel in the has to bada as sigi zeb kijana neshigi sa to dains in the but that does not eat sa le zel in the has. Ishi do but sadil zindolesh kino thini. Ke ashon ze ye chidet aya e kijana neshigi ishi benina. Oh, lashi ko the kosinskagi but that does not de to ya la kon hikeni nazel in the has khada. Zegi nan nishot as kino thini. E benina land is kodo ashona dan hipi nigo nakhada se zegi e nishot at the bikijit na nishti the kosinskagi nast aids at the wilyagi. So kare ya thago nakhada se tadi no nakala na dani since kino thini. Ebony Ekwa the job, but any kid booster shot they thinking that say anything. If you look at the first slide, ladies and gentlemen, you see the update. Yesterday the count was 18 in one day. Some of those were delayed cases. Some of them will be probably delayed into the next couple of days, maybe even today. The reason is that there is not much healthcare professionals, either at the labs or even in our healthcare facilities. People are getting sick. You see that surge here on the Navajo Nation. What's different about this surge is we're so highly vaccinated that not many people are ending up in the hospital. People say, well, I got a shot and I still got the virus, but you're still with us because of the medicine that's pushing back on the virus. And you see that not many people are ending up in the hospital. Yes, you may catch a cold, but it's not severe as if you didn't have a shot. And that's what we're seeing in the hospitals all across the United States. People catching the virus that don't have any vaccination are struggling. Our thoughts and prayers go out to them. I mean, it's their choice, but we here are encouraging our Navajo citizens to get their vaccination, their third shot, their booster shots. No death was reported yesterday. We thank God for that. The second slide shows you a progression. The last 14 days since January 17th, you can see that first jump 500, and then it gradually back up. 366 was the highest on January 27th, and we are 18. You know, with the Health Command Operations Center there, with Galiazi, Sai, and the great team at the Epi are starting to say that we are at a flattening of the curve, but we need to continue to wear our masks. We were out there in the communities handing out disposable masks, cloth masks, and N95 masks, hand sanitizers, and bleach to help those that, you know, keep their home clean, their surrounding clean, using hand sanitizers. We'll be doing that again this weekend. We will post that on our social media page. But continue to follow the protocols, ladies and gentlemen. If you go to the next slide, it just shows you, you know, the length over 21 months of this pandemic. You know, you got that first surge when we started. Then you got the second surge right around Christmas of 2020. And we were doing very well until this new variant, Omicron variant. And thank you, whoever mentioned that, you know, this virus is contagious, very contagious. And that's why it's sweeping throughout the country. And you can see that there in the way far right, February 1st, 22. Who knows what the next variant will be? But as we continue to follow the protocols, we'll keep our community safe, our families safe. If you go to the next slide, that just shows you the comparison between the United States and the Navajo Nation. You know, we've done an outstanding job compared to the United States, but we could do better. We could do better, ladies and gentlemen. Let's follow the protocols as best as we can. You know, people are asking for lockdowns, closing schools. You know, will that help? I mean, we all have a choice. If you have to keep your child, if you want to keep your child at home, you have that right. The schools are told that virtual learning should be available to parents. And if they don't do that, then they need to let your school board members know and let them know that that's what you want. We already followed through with our public health emergency order mentioning that. Now, if you're saying, well, there's so many people traveling, then don't travel. Plan ahead. Get groceries for a week, 2 weeks, if you can, and plan ahead of time. If you got to go to a clinic, hospital, then go to the shopping center the same day. Get your gas the same. Plan everything ahead of time. So when you go out, you take care of all your business, and then you get home, and then you can hunker down. Don't go to the store every day to get chips or soda or whatever, you know. Plan ahead. I encourage you to do that. And we're not going to shut down government at this point in time because we have to provide those direct services, especially now with the hardship checks. The Office of the Controller, you all are doing an outstanding job. Thank you. And the support team, Office of Management and Budget, the post office workers, right? If you see the post office workers, say thank you to them as well. You know, all the there was 48,000 checks that were issued out, CARES checks, $342 to all our elders. Some of them have some address changes that need to be updated. So get with the Office of the Controller. Those elders we took care of. Now with the $2,000 and the $600 for the children, the ARPA, those are going to be starting to be issued soon, either this week, at the end of the week, but most likely on Saturday. And Office Controller have been, again, working late hours, working on the weekends. And these checks are going to go out to our elders. Those 48,000, the first 48,000 are going to be our elders. And so, young people, I know you want the checks. Let's take care of our elders. That's how we were raised. Well, let's get that ARPA hardship checks out to our elders first, and then they'll be issuing out checks for the rest of the Navajo citizens. So I bring that up because people are going to be getting money, and they're going to be traveling, right? Either going to the store or going off the Navajo Nation. Again, ladies and gentlemen, stay close to home. Take these precautions. Wear gloves if you can. Use those hand sanitizers. We handed out large quantities of 32-ounce hand sanitizers out there. And if you need a hand sanitizers, let us know. We can send one out to you too. Masks are in high demand all across the country, not just on Navajo. So don't get mad and say where my N95 or my KN95. It's in high demand. And if you have an address, you can send off for one. But I know that in multiple generations, multiple families use one post office box. So we're trying to address that too, so that we can get masks directly so we can hand them out to community members. And so just be careful, all right? Tell your elders as well, take care of them as they travel. They're going to get some necessities. Yes, the checks are probably in the mailboxes last week and this week. Post office does Eshido Ada Hosniata Badi Nido Les Nishido Ada Any Tlinigi Himasani Hicheni Nalabada Huiliando Le Ede and Hichoba inch kid. If you go to the next slide, it shows the states all around us, the 4 states, and where we're at, Navajo Nation. We're the yellow. And the yellow is way at the bottom, right? And thank you for your hard work, everyone. Look at Utah. Utah's number 1 this week. Right under Utah is Arizona. And then it jumps down to New Mexico. And the last 4th line is Colorado. And then we're the yellow. That's the 7 days COVID-19 rate. So, as I said earlier, be careful if you leave the Navajo Nation. I've been saying stay on the Navajo Nation, but people still leave the nation because of work, school, or they don't have a grocery store nearby on the Navajo Nation. So we need to be safe, everybody. Please be safe. It's when we let our guard down that we're most vulnerable. To conclude, I want to say that 73.8% of the eligible population, that's ages 12 years and older, are fully vaccinated. Navajo Nation residents, right? That's 2 shots. 73.8%. Among the population, the 65 years and over, man, they seem to go up percentages. 88% are fully vaccinated. 88% of those that are 65 and over are fully vaccinated. Thank you, Grandma. Thank you, Grandpa. Thank you, Nellies, for taking this virus seriously. Ages 5 to 11 for the boosters. Let me rewind there. 57,594 booster doses have been given to Navajo Nation residents. All right. That might seem a lot, but look, 48% have received boosters, the third shot. So compare the 73.8% that got first and second doses. Now, when you put the percentage for the third dose, is only 48%. So we need to get our boosters, everyone. We don't know what the future holds. We don't know if there's going to be a new variant. Let's protect ourselves and our families, our communities, and our Navajo Nation. So thank you so much for tuning in to our Tuesday morning town hall. Thank you so much, everyone, for the hard work that you are doing. Continue to pray for your families. Pray for your leaders as well. And in reverse, we, Vice President Myron Leiser, and our administration continue to pray for our Navajo people. 4 things we pray for is strength, wisdom, protection, and good health. And next week, we're going to be talking about how to strengthen your immune system, how to be active. You know, maybe these next 2 days are going to be cold, but spring's coming. And, well, speaking of cold, prepare yourself. These next 2 days that are coming up will be very cold, freezing temperatures. I think the highs in the next 3 days are going to be 30. It's going to be freezing. Check up on your grandmas. Check up on your family members. Don't just rely on the Navajo Nation government. We are told by our elders and our people to take care of most vulnerable population. And let's do that, all right? Help each other out. And we'll be talking about strengthening our immune system better, you know, activity, physical activity, eating good foods, and, you know, that actually pushes back on these viruses, you know. And doing some hard work at home too helps. You know, people don't recognize that, you know, when you're around the sheep corral with all the, you know, the sheep poop and all that actually helps strengthens your immunity. And doing cleaning too, that builds up your immunity as well, keeps you strong. The hard work and push back on COVID-19, especially now when you see that it's going to warm up after this week, possibly. Let's fix up some of those farms and gardens. Let's plant. Let's plant and let's have a good harvest this year. So thank you so much. God bless you. God bless our great Navajo Nation. I'll turn the time over to the Indian Health Services, Captain Brian Johnson. Captain, take it away.
Thank you, President Nez. I appreciate the opportunity to be here again today, and thank you for your words of wisdom and as you continue to lead the Navajo Nation throughout this pandemic. We certainly have appreciated over time working with not only the President's office, working with the Navajo Nation Council, as well as the Navajo Nation Department of Health in various aspects, and just appreciate that partnership and communication. So again, this is Captain Brian Johnson. I serve as the Acting Deputy Area Director for the Navajo Area Indian Health Service in St. Michael's, Arizona, and happy to be here today again as we continue down the road of battling the COVID-19 pandemic. And I just, again, thank those who have continued to lead the fight, whether you're at the Navajo Nation leadership level or working with the Navajo Area Indian Health Service. There's so many people that have been involved and continue to be involved, and certainly been a long road, but we continue to remain positive. We continue to, make sure that we're recommending and providing the best advice that we can based on scientific evidence as we move through the pandemic. We know that, again, I'd like to always comment that we do know, unfortunately, that this pandemic has more so affected Native Americans, American Indians, and Native Americans more so than other groups or sectors of in the United States. And this has been an issue where we've seen infection rates among American Indians, Alaska Natives that are 3.5 times or higher than some of the other races in terms of including non-Hispanic whites. And we've been more likely to be hospitalized, over 4 times as more likely to be hospitalized. And so there are other statistics that tell us that the population that we serve is vulnerable to COVID-19, and we've seen that over the many months that we've been fighting this. We continue to, again, train and work with our staff. We continue to share information. We continue to gather, supplies, making sure that we have ample supplies of vaccine and testing supplies so that we can support our customers the best that we can, continuing from here forth as well. Also, I just want to take a moment as we continue our conversation and just recognize that we have had some support, some staffing support, and I want to thank Navajo Nation as well as others here. We were fortunate to acquire a team of dedicated healthcare professionals from the Department of Defense that are presently located at Shiprock, Northern Navajo Medical Center in Shiprock. And they've been there a week and a half or so. And that's just supporting our staff as our staff has been at the helm for many, many months. And having that extra support is just really helpful in terms of giving some needed rest to some of our staff. And so we do appreciate that. We appreciate the Navajo Nation being supportive of that effort as well. Also, we've been very fortunate that we have been able to secure some United States Public Health Service officers over a period of time who have helped out at the various service units as well. And again, many of you may be familiar in seeing in the hospitals individuals in the healthcare environment who are in uniform. And those are public health service officers. And we do have a number of those. In the Navajo area, we have approximately 240 of those officers, but we've also been able to bring officers in to continue that support, as well as other volunteers that are helping in our health facilities. So not only a big thank you to those who are deployed to assist with continuing our high level of services in our various facilities, but also, of course, our staff who have been aboard working on this for many, many months and have really dedicated their time, their efforts, and oftentimes sacrificing time with their families to work extended hours. That is not forgotten. And whether you're working at a federally managed location here on Navajo Nation or a tribal site, we thank you for your work. We thank you for your dedication and your sacrifice as we've worked through this pandemic. And I just encourage all of those individuals to continue the fight, and certainly we'll get through this together. Also wanted just to remind folks as we talk about COVID-19 over the many months, maybe those who have not ever contracted COVID-19, and maybe folks have kind of gotten away of recalling what the symptoms are and when they might see those. But basically, there are symptoms including fever, chills, things like a cough, It could be shortness of breath or difficulty breathing. Maybe it's fatigue and a combination of these things. Muscle or body aches, headaches, a new loss of taste or smell. That's one of the telling characteristics of COVID is a loss of taste or smell. And I've spoken with many individuals who have had COVID, and they do mention that. Some of them have moved on and have regained their taste and smell, and some others are still dealing with that. A sore throat, congestion or runny nose, nausea or vomiting, diarrhea. These are all various types of symptoms that could come about if you become infected with COVID-19. So perhaps over the months, if you have not become infected with it, it's easy to drift away and not recall exactly what those symptoms are. But basically, once you've been exposed, it takes anywhere from 2 to as many as 14 days for any of those types of symptoms to start developing. Oftentimes, those symptoms do show up in that 3 to 5 day time frame is what we see oftentimes. So it affects folks differently. And so if you have any of these types of symptoms and you're questioning, maybe I don't feel as well as I did yesterday, or maybe I've got some new symptoms. I've heard of many individuals who develop a runny nose and they feel like they're having allergic type reaction. Any of those types of things could be symptoms. And so I do encourage you to get tested if you do come across those or have any questions on that. We continue our vaccination efforts, of course, across the Navajo Nation. And basically, at a very basic level, those that are eligible for vaccination still include those ages 5 and up. And again, early on, we were certainly limited to the adults, and over time, we were able to bring that down all the way down now to 5 years old. And so those where individuals can get their full vaccine doses, and we certainly encourage that. We know that there's been quite a bit of headway made on that, and it's just important to keep that in mind as we move along. So I think to date we're well over at this point 2.1 million doses that have been given in across Indian country, and that's just a huge thank you to tribes and federal staff and urban Indian organizations that have been involved in that. It truly takes a comprehensive approach and many individuals being involved in those and doing a tremendous amount of planning and making sure that vaccines and events are run smoothly. So we do appreciate everyone's work on that. It's amazing, over 2.1 million doses given. So we also continue to, certainly with Omicron coming into our area, and again, Omicron is just a variant of COVID-19. It's just a different type of the COVID-19, in other words. It's a mutation, or what we refer to as a variant. And we know that Centers for Disease Control and others have commented that booster shots are certainly recommended for individuals 12 years old and older. And it's particularly important in the fight against Omicron that individuals have the full dose series of vaccine plus the booster shots. And there are ongoing scientific reviews of cases in terms of the effectiveness of the booster shots as related to Omicron, and it is likely showing that it's very important to have the booster shot is in this fight against COVID-19 for that reason. And I just want to remind everyone that booster vaccine, similar to the full series of vaccines, are available at Indian Health Service, at the urban Indian sites across the United States, as well as the tribal sites here on Navajo Nation. And so if you have questions about that, and I just want to make sure that folks know we continue to have ample supplies. We have enough supplies for whatever is needed here locally. So if you're looking to get perhaps your first series at this point in the pandemic, please reach out to your local health care provider here on Navajo, whether that's over at Tuba City or Crown Point or Northern Navajo, Gallup, Fort Defiance, or other locations here on the Navajo Nation. Certainly all of our facilities, including both federal and 638 sites, do have those supplies on hand and be more than happy to help you with that. So again, we've talked just a little bit about the Omicron variant. We know that over time that we've seen a huge uptick in cases, and President Nez spoke just a little bit earlier about this. And we know that in the month of December is when we really saw the number of cases increase dramatically. And we are certainly monitoring the cases at this point and seeing what will be the next phase in this present uptick in cases. We remain hopeful that we will see a downtick coming up for sure. And I know that Del Yazzie here in a moment will be sharing information from Navajo Nation Epicenter. But I just want to remind folks that, we know that we've seen this huge uptick. And right now, it's a very critical time in the pandemic and our fight against it. We really need to make sure that we continue to use all of our tools to fight this virus and not just start assuming that the numbers will start coming down on their own. We have to remain vigilant in terms of our fight and not give the virus an opportunity to continue increasing in cases. So we do know that there's many scientists are actually studying Omicron and as well as related variants, and we'll know more information on it as time moves forward. But again, we presently know that if we're going to slow the spread of this COVID-19 with Omicron being in the region, that vaccination remains the best public health measure that we can take, that we can utilize to make sure that we're fighting it properly. Also, just wanted to mention, and I always like to take a step back and remind folks that I know that a lot of attention has been on COVID-19 and continues to be, but we also need to keep our eye on the flu, the seasonal flu. We're all familiar with that over the years, and we continue to have the flu vaccine available as well. And certainly want to make sure that for anyone that's 6 months and older, the seasonal flu vaccine is critical to also make sure that we're controlling or managing that as well in the local area from a public health perspective. So keep that in mind, and one can get both COVID-19 vaccine as well as a flu vaccine at the same time. And but we'll leave that to your healthcare provider to discuss that with you. Certainly recommend that you continue to pursue that. So basically, from a summary status, we still have seen a large number of cases here of COVID infections on the Navajo Nation. We remain hopeful that we're starting to see this downtick in cases, but we have to remain vigilant in our fight and doing the right things. We know that Omicron, it's very easy to transmit between people. It spreads very easily. And so it's important, again, that we really make sure we're taking the precautions that we can to hopefully prevent that from again, spreading between our family members, our friends, our peers, who we may be around on a daily basis. In our health facilities, we continue to see, cases of COVID-19 amongst our staff members. And we saw this when Omicron was identified in the region. We started seeing increases in cases amongst our healthcare staff. And so I know our staff are working diligently on infection control and making sure that we're doing everything we can to protect our staff. But we've seen that around the country where healthcare staff have become infected and the numbers have increased. So certainly continuing that fight as well. For COVID vaccine events and clinics, just want to remind folks that all across the Navajo Nation, there continue to be vaccination clinics, both at our healthcare facilities as well and at community locations as well. I recommend that you reach out for a schedule. We try to keep those posted on the OPVP website page with the Navajo Nation so that individuals know where those events will be taking place. And certainly, again, it's really important that everyone receives their full series of the vaccine from the ages of 5 years old and older. And of course, for those who are 12 years and older would be the booster shots. So very, very important. Also wanted to take just a moment to talk about I know over time we've talked about masks from the very, very beginning of the pandemic on this venue, on Facebook Live and others, but particularly now with Omicron and just how transmissible it is or how easily it spreads, it's really important to make sure that we're wearing masks that are well fitted. We know over time, many of us have seen individuals who maybe utilize cloth masks or other types of masks that don't fit well, and that is not very effective, particularly against Omicron. And so one thing's for sure, it's highly suggested at this point that when you're talking about masks, that if you're going to be wearing a cloth mask, that it is recommended that you wear a disposable mask under the cloth mask. That's because, again, the cloth masks oftentimes do not fit well around the nose, sometimes around the mouth area. And so anything you can do to improve the fitting of your mask is very important at this point in the pandemic. Again, disposable mask underneath a cloth mask works, or you can actually move on to a higher level of protection in what's referred to as KN95 masks or N95 masks. And some of those have become a little bit more difficult to secure in the local area and other locations across the United States just because of the demand. So I do certainly recommend the best, level of protection that you can find. And normally the cloth masks that individuals have made over time or have purchased are the lowest level of protection. And so that's why we recommend having a disposable mask under that if you're wearing a cloth mask. Otherwise, you can move up to a KN95 or perhaps an N95 mask for the best protection for you and your family. So just want to mention as we close out here, and I'll be turning the time over to Dr. Jill Jim, our best tools right now to focus on include the proper and well-fitted masks to make sure that you're around your nose area and your mouth, that you're protected. The vaccines and boosters, those are critical at this point in time as well as testing. And we recommend that all of these tools be used to fight against the virus. And if you have questions about that, you feel free certainly to reach out to your local healthcare facility that you normally visit here on Navajo Nation, as we do maintain communications across the Navajo Nation with the various healthcare facilities and providing the same information. So thank you for the time, folks, and wish everyone well. And you take care, and I'm going to step out, and I'm going to turn the time over to Dr. Jill Jim with the Navajo Nation Department of Health. Dr. Jim?
Thank you, Captain Johnson, and those listening on the call. Dr. Jill Jim Donna Initially look on the Tachini Bashashin. Ishe does it say as an additional it's East Bahayan Jibik in not just on the AC Nasha. I think it's all credit the question Tagina state Bahana Desto and he not only President Nes Vice President such a creature Nijaya Dasto credit Adata has no clan hitch and that ocean with Bata needs big ed on the Indo hashing Zachek a credit at the quantity the cousin Saginas at 19 at the Konosni Ashi credit Captain Johnson the dot here non need Ashi credit is it Bahaloni door in his chinto in his piquetas to a thought that it needs a door. A hine kahato bata hanasundo, bata hasyan cried on written there cried Nkanda Kahagi is door. Ashi put big head on Shindea. I just want to transition to English and just want to thank all the listeners on the town hall this morning, and we usually do these regular updates, and I just wanted to spend a little bit of time. I know there was a lot of messaging that President mentioned earlier, and we're thankful for that and the leadership that he brings to the Navajo Nation, and Captain Johnson for reminding us of a lot of things that we've been reiterating through the whole pandemic. And I wanted to share some information. I'm going to share my screen here and kind of just show some information. This is on the Department of Health webpage. So if you haven't gone on there, there's a COVID-19 resources here. And right here, it shows the percent of Navajo Nation residents that are currently vaccinated. The one Dell is going to show has the overall numbers, but if you wanted to look at the areas or the groups so that need to get fully vaccinated. We're looking at the little kiddos between age 5 and 11. So only 34% of those individuals are vaccinated. So we want to get everyone to close to 100% as possible. And the next age category is 20 to 24. Only a little over half, like 56%, are vaccinated. 25 to 44 years of age. And these are individuals that we count are residents that are using the Indian Health Service. So at some given point, I think you might have, individuals might have gone to one of the facilities or 638 facilities to receive services. And so I'm not sure if these individuals, I know those that are age 20 to 44 might be off working in other areas, and I'm not sure if they received their vaccines out there, but if you're working or you're a student out there, I hope you've come home to get your vaccine shot so you can be fully vaccinated and receive a booster as well. So anyone interested in the breakdown of that, that's here. One thing I also wanted just to remind everyone is the isolation and quarantine guidelines for general public and schools. So if you are a parent or a grandparent with a student at a school on the Navajo Nation, and then just for everybody in general, all health facilities are have adopted these guidelines about how long to isolate and quarantine and when to get tested. We are going to send out new messaging around testing until you have symptoms. So not everyone needs to get tested. I know we have had a large number of people getting tested. So just kind of monitor and be familiar with these guidelines, and they're available on the Department of Health. And there's two different scenarios if you're fully vaccinated and boosted, meaning that you're in this category. And if you're not eligible for, or if you have missed your booster and you're past the duration of being fully vaccinated, then you'll fall under this category, and it has different guidelines to isolate and quarantine, where if you are fully vaccinated, you don't have to stay home and you can continue to self-monitor as long as you don't have symptoms. And if you do have symptoms, you probably need to stay home and make sure that you test at various time periods as well. So it's going to be different for everybody, whoever is considered a close contact or if you're exposed. So just know there are guidelines that our health providers have received in order to make sure there's consistency. So when you hear on the news that CDC is saying this recommendation for isolation and quarantine, ours is slightly different on the Navajo Nation. So whatever is presented is gonna be different. So make sure you're familiar with what the Department of Health and Health Command Operations Center is issuing out, and that is what we recommend, similar to how we encourage masking indoors and outdoors. We've done that. While CDC has changed their recommendations a number of times, we have remained consistent in making sure that masking is done. Another thing I wanted just to highlight is the guidelines for home testing. There's a button on the isolation and quarantine webpage. Here you'll see the green button. You can click on that. It has testing schedules, but we also want to encourage individuals who receive sort of these home testing from the health facilities. We have Illume, Binax Now, ClickView, and iHealth are some things that are being circulated that are being provided by the state governments or either Indian Health Service for patients to monitor themselves, and it kind of gives information about how to use rapid home tests. And so just know there are guidelines out there regarding what you need to do, and also contacting the facilities as well and interpreting the results. So it's kind of a lengthy document, so I'm not going to scroll and kind of confuse you on that, but I just wanted to just highlight there is a guideline for rapid home test kits for the Navajo Nation. So hopefully that you can share with your family or with your workplace as well, in order to provide more education on how to use and apply home testing kit results and who to notify too. So I just wanted to end with those three things that I want to share from the Department of Health webpage. So you have more information, and please share one of those items today with a family member, a friend, or anybody to have them become more familiar on ways to prevent COVID, and also share information with others. So I am going to go ahead and hand it over to Dell. He's with the Epidemiology Center and will be presenting the gating criteria. So take it away, Dell.
Okay, great. Thank you, Dr. Jim. Hello, everyone. Can you see my screen, Dr. Jim?
No.
Oh, God. Okay, sorry. Okay, everyone, sorry about that. Hello, Ayate Anocho. My name is Dell. I am with the Navajo Epidemiology Center. Also
We
with
can
our
see the
Health
screen.
Command
Go ahead.
Operations Center. Huh? Can you hear me?
Yes, we can see the screen. Go ahead.
Okay. I'm with also with the Health Command Operations Center Epidemiology Team. This is our 2-week gating measures time period, and our updated numbers here from January 14th through the 27th. Before I move on, I'd like to acknowledge our epidemiology team here working on COVID on the nation. So this is we have a large epidemiology team from people from various entities. So one is, our own Navajo Epicenter, and then our partners from IHS Navajo Area Office, then partners from tribal health organizations, also known as the 638 facilities, and our partners from CDC and the CDC Foundation, and then folks from Hopkins and COPE and TGen from Flagstaff helping us with the COVID strain surveillance, and also our partners from the states, from Arizona, New Mexico, and Utah. So there are a number of people part of our epidemiology team to bring you these numbers. So thanks to all of them. And then, so this is our recent cases and trends. This is a 60-day time period here. As you can see more recently on this downward trend, the red line, these are 9-day weighted center moving average. So this bar here is January 11th, the highest peak here. And since January 11th, we've been kind of going down, although we went back up a little bit here, but we continue to go down. So we're seeing perhaps signs of a peaking and beginning to see a downward trend of cases, which is a great sign, but we like to remain vigilant to continue to monitor these cases. And hopefully the next report will continue to see a downward trend. So our 7-day infection rate is now at 0.97. It did go back below 1. Our threshold is at 1. So it's a good sign that we went back below 1. This is our case incidence across Navajo Nation. A 7-day time period here from January 21st to 27th. There were 1,752 new cases over that 7-day period, which puts our 7-day case rate at 1,106 cases per 100,000 population, which is in the red level of our COVID response on the nation. And then the map here, you see a lot of red, except for Tuba City. All the other IHS and 638 service areas are in the red. So additional metrics we look at: test capacity. Our 7-day positivity rate is at 37%. It did go up from 35% last week. And so there are, about 2,000 tests that were conducted each day over a 7-day period. So that's a lot of testing going on the nation. Our hospital capacity for hospital beds and ICU beds remain below 80%, which again is also a good sign. Our threshold is 80%, so we're below that, so good sign. And then a contact tracers, the daily case ratio is actually 1, not 3. So sorry, that was updated this morning. So so that's 1, and it's our threshold for this is 5. So we're below 5, and continue to monitor that. This is our latest number. This is also being updated today, but this is from last week. Close to 120,000 people have been fully vaccinated. 64% total population are fully vaccinated. And the eligible residents, ages 12 years and older, is almost at 74%. So the percentages continue to go up, even though they're slowly going slow, but continues to increase every week. So people are still getting vaccinated. So that's also a good thing. This is our epidemic curve for the entire pandemic for Navajo Nation in the orange, and blue for the US across the United States. As you can see, we're both trending downward. Again, good sign. This is our 7-day case rate for Navajo Nation compared to the 50 states and a couple jurisdictions. You can see we're down here. We trended the right way from 39th or 37th through 39th position. So we're down here in the yellow bar here in Navajo Nation. And then, but around us, the 4 corner states like Utah, Arizona, and New Mexico continues to see a lot of COVID cases. And then there's just a picture for 7-day case rates across the US. As I mentioned, within our region, a lot of COVID cases, the blue color here for New Mexico, Arizona, and Utah, with a lot of COVID cases. Community transmission remains high for COVID across the US. It's mostly all red. And this is our updated COVID strain surveillance as of yesterday, comparing report 39 to report 40. So Omicron went from 318 cases to 560. So that went up by 242 new cases were identified with the Omicron variant. And then the Delta went from 1340 to 1391. So that's 51 new cases identified with the Delta variant. And all the other variants remain the same. So Omicron and Delta variants continue to increase with each report. And then this is as of last Saturday, the 29th. Omicron variant, the purple bar here, is really the predominant variant across the US, making up almost, it's almost 100% of all the variants being identified across the US. This is the new chapters that made the high-risk chapter list, the green section here, 85 chapters. Last week was 91, so it went down a little bit. So again, it's also a good sign. 85 chapters here made this list. And then over across time, going back 6 weeks, this red column here, going back to December 17th, these 28 chapters have been on this list each week for at least 6 weeks. So, and last, our risk level assessment, we remain in the red threshold or red level for our response on the nation. Positivity remains high at 37%. Public health capacity at 1 is insufficient. And hospital capacity, this is a good thing, we're below 80%. So, and last, where are we right now with the COVID response on the nation? We remain in the red level with our hospital capacity in the orange, being below 80%. So when 2 indicators suggest different threshold levels, the higher level is selected. So for that, we're in the red. So I'm going to stop here and hand it over to Shema, Dr. Fowler. Please take it away. Thank you.
Ihe shiyash kwa atnikich nahuint ani yananat eshik edoshne kodoshe bikit itkanit al kodon hat nahashnet dole shady ma idishkijin shlon torich ini bashichin aro trapa edashe got asche edashanale trottes ahol yeda ade yise chishike kokwe tilate benat ahnlini aj eya shinanish ish ido kodo eya na kita moja en nahaljesha nihil natahuil nito natan hiniti at na kinahe dan hinitina ha iwet sa ato dobik edat otitala jahwin zentla to sani dohas twile inila alla sata walhanna the quidish was nahanna ho andabik edat otit di kodoyan da hasna igi ya Captain Brian Johnson will ye HAD kodo itala debina ani izel jibelta initiative jo kodo ya hehni zinto ati hildelnish ado di Northern Medical Center da hasnije le troche ajibe izel in di to lot so dan long ajik asa anaja nihika anaja to aja adat na kitamo ate la jon hilne Adoti the Kwasna States at Tapati Nini Hashine Lashit Atoda Tabata del Neta Equatel Naha 80 Ejechinito Chiyan Dachto Halni that left Ota Ebehazan Hotol Nai Adoti is Benapin Hasli Iki Naha Net Dog Apahazli do Adeshnin Hitne Adoti Balakanak Eche Omicron Deshne Jo di the Kwasna States at Tapati Nini, Slaho and all Nito, Slaho at Arnas ni, di Jiki Shiki Yego a death no nas ni, Jobalakanak at a contagious yisne, Heda da Hani Yagota, del Kwaso da Bechita na a leisure da Jo ya. What the din jikishi, what the dol natoha, the nolji, skilo nas nihit, a don jikishi ki, a death no na gish, jot adat a epic edit or teen, ado di tlaho ya open hilnahan ne di booster walyani ki isto ashkonde ze lini nakahata tolni hala ne pa adon hilla ta tanda ki ston hi chinton hi ze job tata tes palo na kai ani ya wan ni katnte jo ya wan ni ni adon hiln kita icha pa akot yando pa akon no sen akot da ani hi ta ya di chinto zetan tatal palita na ki ko sa ahote no sen Yego ya atzao enta jo ya nan ho kan ada kodosh chen lini eti kodo ze benapen ilya eti hashine la naha ta ze naha ta ya akoti ze ha alyante na kiton le trate khwa ha ot senda ahwat tol na ot eti jikishi jo et an hebe eta akwiliant enihne jo an hi nit abe kit hi dobe na hi nit hino ada ot eheta akoti ho wade da alla eta bunch ishota jo di home testing kit ne aho wado na al khahida eta jo di izel ebas aj ya klabeta holodo sa de shibe bakachi ado di at yasen tasting at da your kaseta do di na dindo tus your kaset da al kahi aj da al kahi epi team deilne gashin to go kodo zeil in aj deilne shi ba hen ni zendo be behet os di hos doje ado yo toj do so lebel hot soje zeil each da inishje la John Hopkins zodia la CDC edop ihebedi nidole ni di kodoshi ya hol ne ya kontes kit ayai kit kod nitzen don hits adult doch nitzen akodin da al kahi zel ebel nahas anno ati de goil kit akonde zel in kon netes ebel nahas ango ilk sokonet bine kre Zen imbas nahas angoja eti tisk adobe domo yeta ado tinta as kahi contact tracers nini ishla il asa anne kandet ati asa of netsil ke asa ati na aska ado ti izet bahata yai kade as ya asad nezatino anas at the media do bahas tad nezatino atatino anas akone la eti de nebek bekhauta bakat ke hunit ini izet naha alia ado ti na godo ti de nebek bekhauta ya go hil kirkat aya go hil kirdo eni zen ko chin klato be hil kati chato de zen lini akonde dina nihi gi omicron de nini gi saho and on ni de nini na kidneza dino adis dino anaki akune la biga kun hits na des kit ad ende hinate the delta variant that is what adna kit the media do ba ana kit na zatino katino hastra ne kit belaho te ko hotsai na kit ne zatino nas etino tra akod ad ene hinate at the chi kashikedo shedene ado hashine la ni kain lini kodo ni hits bike da hasti konda hasto it ado le shikedo shedene oshi saha honneni gi shi be chahata tsito yo on ni shi be chahata tsiho johot desne sa ya at etas ado sa choinki dota ado kodon hinat ani lini ye hanatze ata holia ata hata notzen akoni he kodona hani zenido yo on benzi kesi benach hot an hilchit huit do esa ye awet di nida jo anil ko shin so bi khati khato bi khat bi si khedo ati bi kha Akotin da kos nas it's atapeti nini do saho ent ol nili Edesni go na akishit ashik edo shidne ebik et otkin. Naha achinin hito ken hinaliket a joben dan notkin. Ado belhata sho jeta. Joti contagious nini skin na akishi dot eat ego et Reda dat de costa bedel na aflache bilja. Aje yego ik kanara o ossen. Akokodo is Bachazlin nini edo nahatalne. Hashine la tilkeji kain lini doi nizenda. Jo abepohodni ko is in dan lini kode nihilin tahalne. Is do bah alyani ki ya anta kato hashin sakabeta betadolna. Akon le bete yonne eta alteho elta. Ikik hashinta aita ze shahato nita nint eko johot ada ya yatalthe o you is at a koti hate yonne et sehopens det zehita hate yonne it so ye goshines ke got o you nihite ne en lini hotal ya do hashine la beke et hasti Do basht edinit edante do isil sa inshi benina san hits hodat za jo konde na antjenantle shik edo shedene a koti ho wache estage na hayat ne a kohashine la do hajobik it itita ni hilla tanda kis ni hit no ben hit yat hit Ako kita to tajit dan na haloben hit nakata at ze to hotan hit dan hijini glado to hashkepen na akwan hit nida jo di ni hilla iban hanitsen ha ida da betol na ha ida da betol ni o bel izzatol chido bel inak etol chido da jo do it ego et on ni lot Ado din hichiton hizep betato desparta di nini na ke kotapen ta khiton hitne ado di hastra ades es ni hitra anaj ekota atahuino senjunan hitne okoti shite betro in ta hakho alto la jishi chitas in shikedo shitne aden khashine la o yubetadesna Di atro ihinte kahi tlatanle del kosota bella chiol on bella chista atena a koota neiti a do hashine lado dinat o izanta jihita a kon yel dat de jaho ote la oto ye eta atahanyana eben na di la jishi chitol etan hiti neti atro ihinta hakaho Ado di K95 mask ne jo ado o kojet de nepa Washington ba ino sene esto ani hipe etan so kes ha de lata holno jo she wisa ko adi K95 mask ni he eten ha de la holno la din ha achinen hitoken lini din chapen se kesi yi eta ye ta hasen ha de la holno Di aja na Georgia butlers da hasna aja sat da hollo da ilni da ilna o a condenes na shja o le hestradon le te beat at da peso that's about da hilne ado paksta na hajilni ho enle istlatin do ba hilne jogot ego da na achne na khandel kha ado ezel ibl nas ango 18 peso la da biga la hachikote to li jo do kwa holongo eti mes da jahi kin hichiton hize betata espali na ke ko atahle ado to jobe na haho ya aho wanchiso da chikoshi na hayat ado kodon hinat an lini isto kodo peso kinal kede peso hichon hotal ya Edo ba hen nosen di person hitchen Italia to pa hanosen. Di hashine la person hitchen Italia di safety wal yaniki elsa winosen shohe kwatsa yandes kito unta naho to le chokol ye elto hashine lan hitne etan lini o peso yilsako a kon a kwich eltochito ilo la banti kes bahanosen din khas twidon hizani dan lini jo elsa peso bechon holne dan Ajito khas twido sani lini ni chain hi masane ni hi maton hi je Bahata no sin dote no sin. Ado ana unleti ndach ete ado ana unleti bitch yataltie na kwa epeson chamon ya kwa atin nla ado tabeton nene hajo opaka andacha ado hako ta doyin kota jo hako ta pelteso keko nahon nikil no shohe kwa etse nikichin petates balish hollo Jogot agot an na ati kepanhat an nosen na has squidon hizani dan lini. Ado di alalange del nishi ni hitalaula ni hitalaun lini tatinosen ado o la al yugo bayatal tie khala na khahalian talaun lini. Ado ko in sesit ahot it's isen de jahin de tatinosen. Eze il eze ne kha Ado ultra nas neloko pata ultra ito bahanosen not ani notleni ado chitil son de bansi ado connect kingonne endal nishita kodo postmaster nle not sos kan na je aja de nishita ay pa heta nosen ado ana nle ibich ayadal tie ado kont on dal nihit o Jindal nishito hajobich ayadal tie Di ad alalange de nish adon hinat anin lini da hehe da bedonne. Ni he peish mahasa anin hitrat nas nela atala de nat ani dan lini. Jo lato ye lata asli ba he no sin. Balakanak eche be thankful dan hitne. Ni he za ba akwasniya. Hashi no latin chapen se kesi bi eta ini. Ni hito na ha winsen. Jo paata do ne koto sad lini anan leti beta do shishi edo kate ne etasle an ne beech na hoyil na e ba honosen koto squido sani yata hashke hot a il on hot an zada Gesh edo enne behandet ol zilta Gela ba masane beche Gade la na ga is Den nehwanne, gela beto ke gela benalike, johot ada yatatje, ba achwinosen do ba achwilnia, ado di beso chol inni, ba achwilnia take safety as a priority, ado ho wadaha ishi be enahot ho wanjita bunch osne, yahanda kaste dadel kaltesonda. Hajoshin panash dios ne akonta da del cleida twishjeta adosh ka anne da dil was shidishin be dina shidato do apen sekesta shidat no be na shidat nestra akoti shida walyeni be eke da nata hatos ne hashine la eke o hata jajon kilnda je Ado tro da bahano akata khas nana khacho at abahaya ado ho watan has adi chinyan ya atehi jothoda sa eta chinyan ya atehi chos on ya ate ako at o yuko be ben najden no ti ho wan has ango nani hema ni he je ni he maya jike ni he ta akhe jo deis o yat ado na has twin hizani ashine la anita hashke o yo ta ho no ebini na hot aha yata athi chik edo shidne ako ta alkidenosen yo o nebe ta ahino tra hajo atatsutato zen ado anini he ol in atat jo ben natje lato ben natkin is dolli hadne ta holno khadin ta hil sosita holno ado aja khatkhali ta holno ze ben hagajato na hasaha o khayu begin ta yin jo alt ya at ban tse keso ado at a kohot a she kodo ben hil na sneto slato bik it tani it a kodo ni hil ishta na lia adon le na kinada moj she aj din hits is na raj immune system dehne aj she it's easier da anhi kodo sa hil chna ta hato a she ni a e ban ta huil nente Hasto it ado leto to bik it o tinta do tse do tsata. Dini hizad lini edesne do denne do behones na eben na hot the neck etches sadiki benchich hanassi. Oko ado belakana sadi chito sapel hit nasne. Hashine la nihitoken hinaliketan lini yeast ot ado yikit iti hot a ko jobe na no tin hashke sato bitni kojiko na antini papito se jot e kodon hichanana si ole shikedo shidne yo dan hini no tati ne koda a kuiche ba na ini ka ko joshin juno ni he tato to de il kasha ne to adon na that the chi to bashed ato ne ado chishda yahata hojadon yamasanin hicheda banda no tra ado desk azo sedan jo des duigot ebel yat ele a kohon sakon hich hanana si o le don jonon he da o na he hashik edo shidne kon sadole